It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments now, we're going to cut into the briefing at Sejong Government Complex with simultaneous interpretation in English. So we're going to go into the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So we're just about to do that now. We're going to listen to the latest number of accumulated cases in the country, as well as hear about what measures are being implemented by the government to contain the virus and stop additional infections, especially after the Itaewon cluster infections that we saw in the central neighborhood of Seoul. So the government is really, it's due to update us on that. There will unfortunately also be an update on the number of deaths as well, as Director General Yoon Tae-ho updates us on the latest death toll. So really we're waiting to hear the measures that are going to be taken by the government, as well as hear some updates of what happened over the weekend as well. So it looks like he's taken to the podium right now and the briefing's just about to begin.
Let us now begin our regular briefing for May 25th, Monday. As of today midnight, we have 16 new cases, and the local transmissions amount to 13, while 3 were imported cases. And as of today midnight, the total number of confirmed cases now stands at 11,206. 10,226 have been discharged following full recovery, while 713 people are in quarantine undergoing treatment. And so far, we have conducted over 826,000 cases of diagnostic testings. And yesterday, we had one more fatality, and the death toll now stands at 267. I extend my deepest condolences to the deceased and the members of the bereaved family. The government today held a KCC meeting today presided over by Health Minister Bang Neung-hoo, and we discussed issues of additional measures for confirmed cases in the metropolitan area and to measures to intensify quarantine for public transportation. And Health Minister Bang Neung-hoo has also said that the resumption of offline classes, which have started from the senior of high schools, will now lead to about 2.4 million students ranging from high school sophomore, seniors in middle school, first and second graders in elementary school and kindergartens. He also called for the close cooperation by the members of the public to curb further local transmissions into schools as well. And he also said that the quarantine authorities is carrying out extensive and massive diagnostic testing and contact tracing. First of all, during the past 2 weeks, we have analyzed the dangers of risks of the COVID-19, and here are some updates. And we have said that when we have an on-day increase of below 50, we have said that these are the aims of our quarantine, and these include 80% of the control and management of the COVID-19 situation. And on a daily increase, we have about an average of 20.3 cases on a daily basis, and we have 5 cluster infections, and we also confirmed that 6.8 of the cases were the sources of unidentified infections, and we have a management condition of below 80%. And our cluster infection starting from Itaewon has not yet evolved into an explosive infections. However, it is continuously to increase steadily. And as of now, we are doing the epidemiological investigations, and we are doing a contact tracing, and we are trying to identify and curb the chains of transmission at an early stage. However, considering the up-to-date considering the latest measures, we believe that it is not yet the time for us to intensify our distancing measures, and we will routinely analyze the conditions, and we will also immediately respond to the outbreak. Next is the outbreak of the cluster infections centering from Itaewon. And in relation to the Itaewon case, we have a total of 223 cases so far in relation to the Itaewon case. And so far, 80,000 cases of diagnostic testings have been conducted. And there are a larger number of confirmed cases among the contacts rather than the visitors to the club. And in order to swiftly respond to the COVID-19 outbreak relating to the Itaewon, we are carrying out swift and massive diagnostic testings. And also, we are also doing releasing and disclosing the information of the times and places that these confirmed cases have went via our regular briefing. And we also urge the members of the public if you have visited these places at the given time, please go to clinic centers to get tested as soon as possible. And next is the intensifying quarantine for public transportation. And since the outbreak of the COVID-19, we are intensifying our quarantine for public transportation, including buses and also limousines and also the subways as well. And we are also mandating the users to wear their face masks. However, we are seeing a warmer temperature, and many of the users and the drivers are not wearing our face masks, and it was unable for the government to strictly manage the situation. And the government has rolled out plans to intensify our mandatory wearing of the face masks. And for buses and taxis, the local government authorities will have the authority to mandate these wearing of face masks, and we will improve the system so that the local governments can mandate the drivers to wear the face masks, and we will also have the mandation of the face mask for the users as well. And as for the railways and subways, we will also restrict the users without wearing face masks. And starting from May 18th, the airlines also have rolled out measures to intensify to mandate their users to wear the face masks, and this will be expanded to include all of the users of the domestic and international airlines starting from 27th of May. And we will also continuously to monitor and inspect the situation. And next is about the utilization of ICT for the visitor registration at high-risk facilities. And yesterday at the briefing, the government has rolled out plans to implement a QR code-based entry for the high-risk facilities. And utilizing the smartphones, they need to issue and download a QR code, and the persons have to show this to the registers to the facilities, and these facilities need to scan the codes and also will allow the visitors to come in to the facilities. In order to protect the privacy information, the government will use only the minimum information of privacy, and these information will be encrypted. And these information will be only shared in different and separate form, and these encrypted information of the private information will be stored in the developers of these ICT technology, while the rest of the information will be only accessible by the quarantine authorities. And the related information will be deleted automatically after 4 weeks. And such electronized visitor register will be mandated for the high-risk facilities that the government has designated. And as for the institutions and organizations that apply for the technology, they could also use these technology based on voluntary matters. And these measures will be put in place as the government has raised its alert level of infectious disease to serious and cautionary. Moreover, if the facilities or the visitors opposed to using and downloading the QR code. And if they also did not bring their smartphones, they would also have an alternative use of confirming their identity via the personal ID cards, and this will also will lessen the disclosure of privacy information. And in order to develop our swift measures against the COVID-19 outbreak, we ask the members of the public to proactively cooperate in our new measure of QR code. And starting from the seniors of high school, this week we will resume offline classes for high school sophomore, seniors in middle school, first and second graders of elementary school, and kindergartens. These measures also call for close cooperation by the members of the public, and we ask you to refrain from going to multi-use facilities and high-risk facilities, and please abide by basic quarantine protocols, including ventilation, washing of your hands, and resting at home. And especially if you don't feel well after the weekend, please take rest at home, and please call our call center at 1339 and get tested as soon as possible. If there are suspected cases within an office, we also ask these businesses to get their employees to get tested as soon as possible. Before we have an effective therapeutics and vaccine against the virus, we cannot be sure until when we will have the prolonged COVID-19, and we will have to live our lives under these conditions. And against this backdrop, we believe that swift identification of the patients is very important. The quarantine authorities are carrying out extensive epidemiological investigations. However, we still have many rooms for restrictions and limitations. And fighting against COVID-19, and the most effective measure to do so is to identify the confirmed cases and the contacts. And we also ask the members of the public to voluntarily get tested if you were at the same place, if as confirmed by the confirmed cases. And we also ask the public to participate in our quarantine measures so that we can curb the further local transmissions. And as for the religious facilities and the hospitals, these facilities also successfully abided by the quarantine protocols, and therefore they were able to manage the outbreak to a certain extent. And at facilities that had very ease and loosening quarantine measures, they had a surge in the number of confirmed cases. So please remember that if you keep your quarantine measures, you can also protect yourself, your family members, and neighbors from the COVID-19 virus. Thank you very much.
That was a live briefing from the South Korean health authorities updating us on the COVID-19 outbreak here in the nation. We just heard that there were 16 additional infection cases, bringing the accumulated total of confirmed cases to 11,206. Unfortunately, there was an additional death, bringing the total death toll to 267. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regularly scheduled newscast at 12 p.m. Korea time. Bye for now.